So our first presentation today will be from Toni and Dr. Aaron. Toni Simmons is the Integrated Health Manager for Mackay Hospital and Health Service and the Autism CRC project leader for our Health Pathways Autism Initiative. Just such a key initiative to help improve and support physical and mental health all throughout the lifespan of people on the autism spectrum. Toni's joined by Dr. Aaron Kennedy, Health Pathways Clinical Editor and Mackay GP. Toni and Aaron are here to tell us what a health pathway is, and it's really important that you do know this, and why specific health pathways for autism are needed and how these pathways will benefit individuals on the spectrum across their lifespan. So without further delay, it really is my great pleasure to welcome Toni and Aaron. So take it away, guys.
Thanks very much, Andrew, and thanks for the introduction. As I said, I'm Aaron and joined with Toni. Similar to Andrew, I'll just start by acknowledging we're in Mackay today, traditional lands in our area, the Yubera people. So I'd like to acknowledge the land that we're on and pay our respects to elders past, present and emerging. I'll just share our screen so that you can see our presentation. As you can see there, this body of work that we're going to introduce to you has had a number of partnerships develop over the course of it, and they're all listed at the bottom there, including the Autism CRC, Mackay Hospital Health Service, where we're both located, the North Queensland Primary Health Network, Mackay HealthPathways, who are also part of Streamliners Group, who are based in New Zealand, University of Queensland and QCIDD. Who've all had input into the development of pathways that we're going to present today. So starting with what we know, we already know that people on the spectrum experience unique health-related needs and may exhibit poorer physical and mental health outcomes in comparison to the general population. Research demonstrates that people with autism have a markedly increased risk of premature mortality. This is just a study that had a big impact on me when we started the our research into this project, and also had a big impact on our early participants in our project groups. It's a Swedish study, and it demonstrated that there was a significant risk of premature mortality, up to 20 years in those with low support needs, and even an average of 40 years in those with higher needs. And these were all conditions that could be managed through better preventive care. Additionally, there was a lack of information on how best to support individuals on the spectrum across the lifespan. Australia and New Zealand, we're very privileged to have a long history of specialists in preventive care. We know them as GPs, but autism has likely remained off our collective radar to incorporate those preventive activities, specifically with this patient cohort.
So to take that further in terms of what Aaron was saying, when we first started this research project within an Australian primary healthcare sector, predominantly general practice, there was very limited evidence-based knowledge and understanding of the lifespan healthcare needs of people on the autism spectrum. As a result, we also found that there was a lack of consistent management, limited follow-up for physical, emotional and oral health needs, limited support for GPs available in a single point or pathway. There was also limited health professional developmental opportunities within the area of autism, especially in regional and remote areas. There was no established or emerging cycle of care, which is a detailed set of patient management steps that a GP can use to support the health management and health assessment of people on the spectrum. And these sorts of management cycles or cycles of care are actually used for other conditions such as diabetes and those sorts of things. So in order to try and fill some of these gaps that we found is where we started the Mackay HealthPathways Autism Initiative. So the aim of the initiative was to try and develop and implement evidence-based clinical pathways for children, adolescents and adults. So then we had a resource for our health professionals, which gave them the ability to assist in the assessment and management and health and well-being across the entire lifespan. So the first phase of our study actually involved scoping out our local environment, as Aaron had stated. So to do that, we held quite a number of sessions in the beginning, some predominantly with our health professionals and others with support groups, and actually talking to parents, carers and individuals who identified as being on the autism spectrum. They were given the opportunity to participate in these sessions and education sessions, and also to be involved in completing questionnaires around, for health professionals, their confidence in managing and assessing, and also for carers and adults on the spectrum, their journey that they had whilst going through the whole assessment type phase. Understanding of this sort of information before we started this work was paramount. So then we had an idea of what the actual barriers and enablers were from our health professionals and our consumers' perspectives in the beginning. And the data on the screen quite clearly demonstrates that from our health professionals' perspective, their confidence in assessing and managing was actually quite limited, and a lot of them had very limited education and upskilling in this space as well.
So in order to fill that gap that we identified, we developed this suite of updated and new pathways with a particular focus on post-diagnosis care. So these pathways were the result of over 2 years of work with the partnerships that we had developed. The first two pathways on the list, as far as we know, are the first of their kind and designed to help GPs both anticipate and to meet the ongoing care needs of people on the spectrum after their diagnosis. The other pathways we reviewed and updated primarily from one of our Sydney HealthPathways sites. So we've mentioned HealthPathways a few times now. So what is HealthPathways and why use HealthPathways as a platform for developing this? HealthPathways is an online manual used by clinicians, and the pathways are designed for point of care. So they are very targeted to be used while the clinician is with their patient to help them assess, manage, and make appropriate specialist requests. Rather than being a traditional guideline, each pathway is a local agreement between primary and specialist services on how patients with particular conditions will be managed in the local context. So each health jurisdiction that takes on health pathways do localizations of pathways to reflect local arrangements and opinion, and then deploys that instance of health pathways to their local clinical community. The target audience is primary care, and in particular the GPs in the primary care team. And the aim is to accurately reflect all the healthcare options that a patient can access within that community. HealthPathways has been implemented now in over 40 health jurisdictions. So it's probably got a potential impact on over 48 million people across New Zealand, Australia, and also the UK. Because it's already established as a primary care tool, it makes it much easier to introduce new resources to that community. Because all the pathways are written in a consistent format, clinicians find it much easier then to navigate to the information that they need to help manage their patients.
So once we had all of the pathways finalised and we took them live onto our HealthPathways site to support the go live of the new pathways, we facilitated a symposium event, which is entitled Through Their Eyes, Through Their Lives. We had 4 guest speakers, which came along to discuss various aspects of care needs for people with autism, including a lived experience, and 2 of the presenters were parents of people on the autism spectrum as well. So this event was the first of its kind for our region in terms of education event aimed at general practitioners, and was a half-day free event. And Aaron's just going to switch screens now because during the event is where we also demonstrated the live pathway. So Aaron will now just give a really quick demonstration.
Yeah, so this is the Pathways site that holds all the pathways, and not just around autism, but around sort of every condition that a GP might be wanting to look for. And this is just to demonstrate how a GP might find information to help them manage a patient. So you can see it's got intuitive search built into it. It'll bring up all the pathways that will mention autism, or in this case ASD is what I searched under. I'll just quickly show you the pathway that we developed particularly for autism in adults. Each pathway follows this exact same format, so it becomes really easy for GPs then to navigate to the information that they're looking for. The basic format is an assessment section, a management section, then a summary of all the request points. So from management, any point in management that says request a certain service, they're all summarized in the request section down below. Then there's an information section covering extra information for health professionals, so pointing them in the direction of further education, further reading to further their knowledge if it's an area that they're not familiar with, and also linking into patient resources so that the GP is able to then print those off or direct the patient to websites and those sort of apps so they can access them directly from there. So it's pulling a lot of resources into the one page, including areas like Medicare, how to set up a clinic to make it more accessible for somebody on the spectrum. We try to include all of those sorts of details in the pathway.
So since the go live of the pathways, Health Pathways is attached to Google Analytics, which means that we have the ability to track utilisation and specific page hits to the particular pages. So since the go live, we actually saw quite a significant increase in the utilisation of the Autism Health Pathways. So as you can see on the screen, from July 2019 through to around that October type period, it was around the November, December, January area that we were going to do a big implementation engagement session and go around to each of the general practices. But unfortunately, as we're all aware, January seen us start the COVID-19 pandemic, which obviously quite significantly impacted some of our engagement strategies that we did have planned. We have since seen, though, because obviously from January onwards, the COVID pathways became quite significantly used in Health Pathways. But just recently, tracking the analytics again, we actually did see another significant spike in utilisation in February, and that was with the child and adolescent pathway, and that could be attributed to school just returning, and obviously GPs needing to get the guidance of that page to look for further assessments. So as I previously mentioned, we were very unfortunate that COVID-19 happened right towards the end of this research piece, which obviously, as I said, impacted our ability to do the final parts of engagement, but it also then affected our ability in terms of the final evaluation as well. So the initial design was set up to do a post-evaluation after implementation to gain some insight from our general practitioners in terms of their confidence post utilising the pathway and how effective the pathways were for assisting and assessing and those sorts of things. So we had to kind of change a little bit of our strategy, but we were able to get 16 health professionals complete a post-pathway evaluation. From that group, there was only one GP that had utilised the pathways who had very positive feedback. But during those sessions, it gave me the opportunity to then demonstrate the pathways to the other health professionals that completed the evaluations who were actually quite enthusiastic to go back and have further looks. But our post data did demonstrate some very, very similar statistics in our pre-data, and hopefully we would anticipate with better utilisation of the pathways that the confidence levels would actually start to increase.
So finally, where to from here for the pathway? First of all is a rollout to the rest of the Health Pathways community. As I said, it's a very large community. This pathway has been developed in Mackay, but with a view to a very broad uptake across all of Australia and New Zealand. There's already been several teams looking at a localisation of the pathway. Probably the most advanced in that area is Western Australia, who have been through the process of reviewing the pathways with their own local subject matter experts. One of our ongoing tasks in Mackay is just to ensure that any pathway improvements that occur during that process are captured back in the Mackay version. This not only improves our own pathway, but ensures that iterative versions will benefit from those improvements. So any other region that, for example, will localise from Mackay benefits from an improvement that was made in Western Australia. We've got a number of pathway sharing mechanisms in place to facilitate that. The other thing is no pathway is ever set in stone. As I'm sure everyone here is aware, evidence is always expanding and new resources are constantly being developed. So a perpetual challenge for researchers is to translate that evidence to the frontline clinicians where it can be used to make a difference. We hope that this pathway will allow that to speed that process of getting resources to the frontline clinicians so that it can be used to have more impact on patient care. So we're looking forward to sharing this work more widely with our colleagues outside of Mackay. And thank you very much for your time today. And we'll look forward to answering any questions that may have come up during that time. And I'll hand back over to Andrew.
Thank you so much, Aaron, and also to Toni. That was terrific, guys. And you know, hats off to generalists. They have to know so much about so much, and it's really important that there's also support that and further information that they can access. And that's just the wonderful thing about Health Pathways. And it's even more exciting from my perspective that there is starting to be not saturation, but definitely greater reach of Health Pathways, so we can have coordinated consistent pathways around Australia. It's just and the world. It's really terrific. So thanks for that, guys.